The survey, which is population-based, will be implemented in 6 waves until July 2020. The objectives of the survey include an assessment of the impact of COVID-19 on health, labor market, transport, and housing. The survey is also aimed at assessing the awareness of COVID-19 and the appropriate protective measures. The data collection for the first wave was undertaken from 2nd to 9th May 2020. The survey is being implemented using computer-assisted telephone interviews approach, in which the interviews are conducted through telephone. This is a very targeted new innovation. You are aware that in the past, we used to send a team of data collectors to the field, but now we have substituted with the use of this method that uses telephone, assisted by computer, through computer-assisted telephone interviews. Ladies and gentlemen, among the key findings of the report in the first wave of the survey includes economic activity. And this is the outcome. The participation rate of the population aged 18 years and above in the 7 days preceding the survey was 56.8%. About 2/3, constituting about 65.3%, were males and in the labor force, while slightly more than half, 51.2% of the females, were found to be outside the labor force in the reference period. That means that the people who were able to be interviewed, in the group of male, 65.3% were people who are in the labor force, while for females is only 51.2%. Almost half of the respondents who were absent from work said that it was due to lockout or stay away instructions as guided by the government and employers. It's clear that the direction that has been given by the government or the employers to stay at home has actually now manifested itself here. On transport, overall, there has been a 51.7% increase in the cost of transport. Migori County recorded the highest increase, while Turkana recorded the least at 77.2% and 24.4% respectively, meaning the cost of transport in a county like Migori increased by 77.2%, which is almost double. In the area of rent, the results show that 21.5% of the households in Kenya who usually pay rent on the dates agreed with the landlords were unable to pay rent for the month of April 2020. Reduced income earnings was cited as majority, that is 52.9% of the households, as the main reason for the inability to pay rent. Meaning, the first line of response gave indication that most of them were not able to pay rent on time because of the reduced income. Only a small portion of about 8.7% of households received waivers or relief from their landlords for the same period. That is quite minimal. On health, findings from the survey show that 17% of the households reported having at least one member with a pre-existing medical condition. It does not necessarily mean COVID, but 17% indicated that they live with a family member who has a pre-existing medical condition. About 12.4% of the households reported having a member who had sought health services during the period under review. Regarding knowledge on coronavirus, encouragingly, almost all adults age 18 years and above, constituting about 99.4%, have heard about the coronavirus. That shows, how our people are very good consumers of public awareness campaign. Majority of those who had heard about the coronavirus acquired the information through radio and television, which at about 82% for radio and 63.3% for television. Accordingly, according to the survey, 97.2% of households cited soap and water for hand washing as the main method that one can use for the protection against coronavirus. Regarding coping mechanism on learning, as you know, this is one critical area where families and the entire population are very keen to know, because they live with children of school-going age and the schools are not on now. So we tried also to find out how parents or families were coping. Nationally, more than 57.9% of the households have members who usually attend learning institutions. That's what the survey indicated. Out of the ones who were interviewed, 57.9% indicated that they have members who usually attend learning institutions. Homeschooling was reported as the main coping mechanism used by majority at about 42.8% of the household for their members to continue with learning. So you can see, out of the eligible, out of the learners, about 42.8% are at home, but they have access to some form of, learning. They cope under that situations. Meaning because they are continuing with their learning in situations just from the comfort of their homes. Notably, 24.6% of the households with members who usually attend any learning institution were not using any method to continue with the learning at home. It's clear that, from the interview, 42.8% of the households for the members continue with learning from their homes, while 24.6% have either no access or generally not continuing with any form of learning.